Now, we come to the abdominal muscles, and the first one that we're going to discuss is the external abdominal oblique. And the external abdominal oblique originate from the thoracolumbar fascia, which is the deep fascia that cover the area of the back at the level of the end of the thorax and the lumbar region, and from the lateral aspect of the last few ribs. The fibers of the external abdominal oblique will run caudo-ventrally. It will go and insert through an eponeurosis to the linea alba. And the linea alba, it is this line here. This is a fibrous connective tissue on the mid-ventral aspect of the abdomen, which act as an insertion of the abdominal muscles from the left side and from the right side. And the linea alba, as you know, is a landmark, or it will give you access to the abdomen without any bleeding, because there is no blood vessels and there is no nerve runs at the level of the linea alba. So when you cut through the linea alba, it's a bloodless entry to the abdomen. Now, the external abdominal oblique originate from the thoracolumbar fascia, from the lateral aspect of the last ribs, and it has two insertions. One insertion to the linea alba, so it has an abdominal insertion, and the other insertion is to the pelvis. Okay, so it has a pelvic insertion and it has an abdominal insertion. So when the eponeurosis of the external abdominal oblique separates to form these two insertion, it will leave this slit here. Okay, this slit here within the eponeurosis of the external abdominal oblique. This represents the superficial inguinal ring, through which the spermatic cord will gonna come out from the abdomen to go all the way to the testes. Now, what comes out with the spermatic cord is through the superficial inguinal ring is the cremaster muscle. You can see it here. It is attached to the outer vaginal tunic. And you know that the cremaster muscle is an extension of the internal oblique muscle, as we're going to see in a minute. Also, you have the external pudendal artery and the external pudendal vein also come out through the superficial inguinal ring. Also, with this nerve here that run on the dorsal aspect of the external pudendal vein, and this is the genitofemoral nerve. Now, the most caudal portion of the pelvic insertion of the external abdominal oblique eponeurosis, we call this the inguinal ligament. So the inguinal ligament, it is just the most caudal strip of the eponeurosis of the external abdominal oblique. So external abdominal oblique has abdominal insertion to the linea alba, and it has the pelvic insertion, and this pelvic insertion will going to form this inguinal ligament, which is this strip, which is the most caudal part of the eponeurosis of the external abdominal oblique. We call this the inguinal ligament. Okay, this slit here is the superficial inguinal ring. You need to be very careful when you are dissecting this area not to cut the eponeurosis of the external abdominal oblique, because that will going to mess up the superficial inguinal ring and you're not going to be able to see. In the female, what comes out through the superficial inguinal ring is a vaginal process, which consists of the round ligament of the uterus and some fat. In the male, the spermatic cord, which consists of all the structure that we're going to go all the way to the testis, that include testicular artery, testicular vein, testicular nerve and lymphatic, vas deferens artery, vas deferens vein, vas deferens nerve and lymphatics. These are the actual structures of the spermatic cord, surrounded by parietal peritoneum that form the vaginal tunic. The cremaster muscle is an extension of the internal abdominal oblique, and it is attached to the outside of the spermatic cord. It is attached to the outer, to the parietal vaginal tunic. Although surgeons will consider all this together as the spermatic cord, but from the anatomy point of view, we want you to have the understanding that it is the cremaster muscle attached to the outside of the parietal layer of the vaginal tunic. Now, the abdominal insertion of the external abdominal oblique will gonna form the external lamina of the rectus sheath. This muscle here is the rectus abdominis muscle. We have one on the left here and we have one on the right here. The external abdominal oblique epineurosis will join with the epineurosis of the internal abdominal oblique to form this external lamina of the rectus sheath. Bear that in mind. Now, once we reflect the external abdominal oblique ventrally, this will expose the internal abdominal oblique. And the internal abdominal oblique is originating from the tubercocci, and it go and insert on the mid-ventral line in the linea alba through an epineurosis that will join the one that from the external abdominal oblique. So as you can see here, the epineurosis from the external abdominal oblique will join the epineurosis of the internal abdominal oblique. Together, they will form the external lamina of the rectus sheath. If you look at the fibers of the internal abdominal oblique, you can see that the fibers run cranio-ventrally. As soon as you reflect the internal abdominal oblique, the muscle that, with the fiber that runs transversely, this is the transverse abdominis muscle, and the transverse abdominis muscle epineurosis will go and insert on the linea alba, forming the internal lamina of the rectus sheath, which is this part here. This is the rectus abdominis muscle. This part here is the internal lamina of the rectus sheath, which is the epineurosis of the transverse abdominis muscle. And this one here from the outside, this is the external lamina of the rectus sheath that is formed by both the external abdominal oblique and the internal abdominal oblique.